Hi, I'm Justin Riley. Today on Wisconsin Doctors, June is National Safety Month. Patient safety and healthcare quality has come a long way and continues to make improvements in modern day healthcare. And we're here on location at Bluff Medical Center to find out exactly why a rural hospital has just as much to offer in terms of safety as an urban or city hospital. I have a great team of panelists to talk with me today, including Dr. Timothy Bielen, who is actually the Chief Medical Officer here at Bluff Medical Center, Anna Green, the Director of Quality, Risk, and Utilization Management, and Janelle Haskey, Director of Clinic Quality. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. June is National Safety Month, as we all know, and we are joined by a fabulous team of professionals here at Bluff Medical Center to talk to us about patient safety and quality. And my panel includes Dr. Timothy Bielen, Chief Medical Officer, Anna Green, Director of Quality, Risk, and Utilization Management, and Janelle Haskey, Director of Clinic Quality. Welcome, everybody.
Thank you.
Thanks for having us here today. So before we get started talking specifically about patient safety, I want to give everybody the opportunity to introduce themselves, talk about their role here at Bluff Medical Center, and also how they're directly involved with patient safety. So Dr. Bielen, let's start with you.
Well, thanks for inviting us, and this is a great opportunity to talk about our favorite subject, which is quality and safety related to our patients. I'm Dr. Tim Bielen. I'm a family physician by training, and I've been here for 25 years, since 1990. I first started my journey just as a physician, trying to do my very best for each individual patient. But over time, in my role as the emergency room director, I discovered that there were ways that we could improve processes that would help a whole population and group of patients so that our community would improve. And as part of that journey, I have also, in my administrative role, learned more of the importance of quality and safety and how it applies to each of our patients and their families. And so it's great to have a wonderful team here that helps us with this process, and that we diligently continue to monitor it as well as try to improve quality and safety issues in our hospital.
I think it's fantastic when you have an eye, when you're able to have an eye for what can be improved in areas like that. That's great. That's great. Anna.
Hi, well, thank you. My name is Anna Green, and I have been here since 2012. I've actually been in healthcare for about 16, 17 years, and quality and patient safety and risk management itself about 10 years. And as soon as I started in that role, I knew this is where I belonged. Kind of to spin off what Dr. Bielen said, I'm not clinical, but I do have a background in healthcare administration, so I can kind of look at it on the other end of it and look at the processes and how do we break that down and make things easier. Because as you know, healthcare is a very complex system, and being able to make things easier for our healthcare doctors and providers to do a good job, and for patient safety for the patients, that's really key. And it takes everyone working together to do that. I really have a love for seeing a job well done and seeing people that they actually go through the process and make things better, and then they kind of have that aha moment and know that, hey, I make a difference even if it's something little.
Right.
So.
And it sounds like you're able to kind of disseminate information to patients and to other clinical staff that maybe don't have the background knowledge that somebody who's gone to medical school, for example, does, which is really, really helpful and really important, I think.
Yes,
too, so.
That's very easy for me to do because I don't have the medical background. I can actually explain it to staff and patients easier. And in addition to that, sometimes when I'm in meetings or I hear people talk, I can say, okay, now what does that mean? Or what will that mean to the patient? Let's make that easier. Because as you know, a lot of people don't understand our lingo, or unless you're talking to them on a very basic level. And it's actually kind of a generational thing that older folks might not ask because they don't feel comfortable. So it's up to us to be able to recognize that and communicate.
Yeah, yeah. Janelle Haskey, how about you?
Hi, thanks for having me. I've been here at the medical center here for 18 years. I've been in the role of quality for 2 years. I really enjoy that. The part that I am with is the 5 clinic system, so I focus more on the clinics, complimenting Anna in her role in the hospital. So, and kind of on the opposite side of Anna, I like to be able to take those numbers, those things, and present it to the clinical staff and providers, and being able to help them understand it as well, being a nurse as my trade. So I like being able to do that, and when you see them understand that, see their numbers improve, that's a great, I love it.
That's got to be a rewarding experience to have that.
Very much.
Absolutely.
Very much so.
We got to take a short break, but when we come back, we're going to continue talking patient safety and quality, and we're going to talk specifically on how to initiate the process. We'll be right back here at Bluff Medical Center with more Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. Today we are talking about patient safety and quality of healthcare here at Bluff Medical Center, and I have a great team of professionals to talk more about that. And I want to talk a little bit today about getting the process of patient safety and quality started. And Janelle, I'm going to start with you. It sounds like Bluff, I mean, based on what you and Anna have said in the previous segment, it sounds like you are constantly trying to focus on safety and quality. With this being such a broad topic, let's walk through some of the steps that are taken, the initial steps that are taken when it comes to tackling something that's this important, something as important as patient safety.
Sure. It's our number one priority is to have that safety first, you know, and we want to provide that high quality care to all of our patients and their families. And we have different measurements and systems in place to ensure that we do that. We also use resources. We can use them in form of like collaboration, working with other organizations and seeing what are some of their best practices that they're doing, and they share those with us and we do the same back with them, and that is a nice asset to be able to have. Another great resource we have is the list of national patient safety goals that we need to abide by. And those are updated every year, and we need to be following those as well.
Absolutely. The National Patient Safety Goals, Anna, I'm going to turn to you for a moment. Can you talk to us a little bit about what the National Patient Safety Goals are and how does Bluff stay focused on those?
Sure. National Patient Safety Goals were established in 2002, actually started in January of 2003 by the Joint Commission, which is our accrediting body, and it is the largest accrediting body out there in healthcare. They established these to help hospitals focus and stay on track on some of the biggest patient safety concerns out there. There are about 15 or so national patient safety goals. They are updated yearly. Sometimes the same ones are on there because they're so important. There's a lot of things that we do here that are behind the scenes that patients might not recognize. That, by and large, is a lot of the patient safety goals. However, some things that people might recognize is that two-patient identifier. That's a national patient safety goal. It's a very important one. So people might feel like, oh my gosh, why are they asking my name and my date of birth all the time? Don't they know me? I get sick of saying this. Well, it's because of patient safety. We need to make sure that we're treating the correct patient in the correct location. I mean, you can imagine how easy it could be to get a piece of paper in the wrong place that might identify that patient wrong. So that's very important for us to do that to patient identifier. Other things that they might notice is hand hygiene. That's a huge one. And it seems kind of like a no-brainer, but that is truly the number one safety thing everybody has control of, not only healthcare workers, but families and loved ones and everyone, not only in the hospital, but elsewhere. However, we do really focus on what are the best standards in the hospital to help prevent spread of disease and infections and so on and so forth. So again, that's to protect our patients for safety. Another one is we have our medication communication. That's a huge one. And as and you guys probably know as well, when you go to the doctor's office, there's that sign, bring all of your medications with you. Why do they keep asking me about all my medications? Well, medications change frequently. A lot of people are on a lot of different medications. How do they counteract with other medications? So it's very important that our entire team, nurses, pharmacists, doctors, everybody understands what kind of medications patients are on, and then to keep the patients informed as well.
Yeah,
so
absolutely.
Those are things that patients and families might understand that we're doing when we're asking some of these questions, but it's all for the safety of the patient.
Really quick before we go, Dr. Bjelland, when patients, Anna talked about patients getting asked to repeat their name over and over again, or sometimes if they're going into surgery, they're asked what part of their body is being operated. It's not because the healthcare professionals don't know, it's for safety reasons. It's to promote safety, to make sure that everything is consistent.
Yes, we certainly have these processes to try to track all of these things, but the most important element is that we do it right each time with each patient. And so that's why we want to verify, because we always want to be sure. And it's been shown that patients and their family help us with that process and make sure we do the right thing for the right patient at the right time.
Absolutely. We got to take a short break. When we come back, we're going to talk about how patient safety is a team effort here at Bluff Medical Center. It's Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We are on location at Bluff Medical Center in Mauston talking about patient safety and healthcare quality. And, we've done a number of shows here in the past, and Janelle, I'm going to actually jump in with you. I mean, the team effort really seems to be a strong theme here at Bluff Medical Center, and that's even true when it comes to safety, isn't it?
Absolutely. And it's not just between our departments in our organization, because we do have a large organization, so there's different departments that need to be communicating back and forth for the safety of the patients. But then it's also the staff working with the patients and their families as well. And that, when you get that, then you've really got it good.
Yeah. And I imagine that the systems that you have to have in place have to just be rock solid, and you almost have to have a system of redundancy to make sure that everybody's communicating properly.
Right,
so,
exactly.
Anna, can you give examples of some specific safety initiatives that patients and family members can be involved in while they are, in the hospital setting?
Yeah, absolutely. Kind of to echo what I said before, there's a ton of things that we do behind the scenes that patients and families might not know about. But some things that they might recognize is we have a fall prevention program. And anytime a patient comes in the hospital, we have a way to identify what risk they are at falling, because sometimes family and even patients don't realize that they're sick, they don't feel very good, they're not in their normal environment, maybe they're dehydrated, and they are at a risk of falling. So if they score a certain level, then we will signify that by putting a yellow star on the door, and they also have red slippers that they wear. So then if they go anywhere in the hospital, that anybody knows that this patient is at risk of falling, and we take a little bit more precautions with them. So that's one thing. And then we also have what we call a family rapid response. Now, all that really means is, hey, if there's something you recognize about your family member that we might not see because we don't live with them, we don't know them as well as you do, then call a team, call us in. We want to, get together and look and see if there's something going on. And all of that information is actually in a red card in a folder when the patients come here as an inpatient. So that's very good, information for families and patients to know. We also have interpreter service, because sometimes people don't speak the same language.
Right.
So that can be done through a phone or an iPad, because again, communication is key. And without having that communication, we have to be able to treat that patient, and that's patient safety.
Yeah.
So our interpreter service for newborns, we take that very seriously. And not only is the mother ID'd and the baby at birth, but the father is as well.
Yeah.
So that baby can only be in the presence of either our staff, and then we talk to the family about that. or with the parents, and it's never left alone. So that's another thing that we do that folks might recognize and they can have a role in for patient safety.
Dr. Bielen, I want to turn to you for a minute because there are a number of teams and committees that have been formed to address and discuss and develop safety and quality initiatives. Can you talk to us about what some of those teams do?
Well, I think one of the things that you talked about was redundancy and being able to really capture all of that data and make sure it floats up. And it's very important to each medical practitioner the quality that's being provided. So not only do we have systems in place where individual teams meet, such as the OB committee, such as the medical care committee, that actually meet and review individual items related to their particular department and process, but we have an overall committee in the form of the quality committee, which allows us to really take from all departments and monitor on all department levels the results of those particular things so that we really have a big picture. And I even bring that up to the all the way up to the board level to make sure that the board is aware of all of those things too, and we report regularly on that as well.
Yeah, absolutely. When we got to take a short break again. When we come back, we're going to talk about how quality, healthcare quality, and patient safety is an ongoing process right here at Bluff Medical Center on Wisconsin Doctors. Don't go away. Welcome back to Wisconsin Doctors. We're on location at Bluff Medical Center. We're learning about healthcare quality and patient safety. And Janelle, I'd like to start again with you. You know, everything that we've talked about, it sounds like healthcare quality and patient safety is an ongoing process. So can you talk about what Bluff does on an ongoing basis to help ensure that health and safety always remains in focus?
Sure. We use the PDSA cycle for our improvement, which is the plan, do, study, act.
Okay.
So briefly, we want to look and take what project do we want to look at, and we need to be specific in that, otherwise our data is going to be way too big. The do part is what tasks do we need to do to complete that and look at. Study is actually studying what we said we were going to do and look at that and say, do we need to adjust it a little bit? Do we need to go back and relook at that? And act is taking the actions and doing the improvements that we actually need to do, that our study showed that we need to do. We also do a safety survey, and that can identify some areas that we need improvement on as well. In addition to that, all of our different departments usually do between 2 and 4 improvement projects every year. We put that on a dashboard for all of the employees to be able to see, and that way it keeps us sharp.
Yeah, keeping you sharp, keeping those tools sharpened. That's great. PDSA, plan, do, study, act.
Yep.
I love it.
Got it.
Anna, can you shed some light on some of the publicly reported data that's out there about medical centers?
Sure, yeah. This is one of my favorite subjects.
You're a data girl, aren't you?
Yeah. Yeah, exactly. Actually, because of the size of our hospital, we are a 40-bed acute care hospital.
Okay.
We are required to participate in some of these federal publicly reported programs. Critical access hospitals aren't necessarily required to do that. While I think they're very good programs, it is sometimes what's out there in the public is a little skewed because we have such small numbers. It doesn't always reflect true 100% quality in what we're doing here. We do think the programs are very important and we watch them. We're actually doing very well in them. But we look beyond that. There's a lot of things that are in those programs that overlap into other programs and so on and so forth. There's also things that are indicated that are in those programs, for example, infection control. But our numbers are actually so small that they don't get included, but that's not necessarily reported in the public. So we look at everything 100%. Also, the state of Wisconsin has some very nice publicly reported programs, and Checkpoint is out there that Wisconsin Hospital Association puts on, and they do a very nice job, and the public is able to go out, and anyone can go look at that data as well. So,
Dr. Bielen, what are some of the new current safety initiatives that are taking place at Bluff?
Well, we have several that we're working on, and actually they're probably too numerous to talk about here, but just to highlight a few, we are really working hard at improving our stroke care with more immediate care, particularly with what we call fibrinolytics, to try to reverse the using a clot-busting agent to try to help with that. We're also very much aware of the increasing antibiotic resistance in bacteria, and so we're doing an antibiotic stewardship program. So those are just a couple of the programs that we really are focusing in on. Finally, the final one, which you may not say directly relates, but it does, is actually patient engagement. We monitor surveys, we look back at that because we know that reflects as well how well we're doing with the quality and safety from the patient perspective.
Excellent. And I think it's important for viewers to know, and I'm just kind of summarizing because we just have a couple of seconds left. Maybe one of you can touch on this quickly, but it's important for people to know that a rural hospital, you're going to get just as high quality of care as you would in an urban hospital. I think that that's fantastic because you guys have those supports in place.
Yes, and we do compare to those hospitals as well, across Wisconsin as well as across the nation, and so those are the benchmarks that we shoot for.
Absolutely. Well, I've been joined by a fabulous team of professionals here at Bluff Medical Center. Dr. Timothy Bielen, Chief Medical Officer, Anna Green, Director of Quality, Risk, and Utilization Management, and Janelle Haskey, Director of Clinic Quality. Thank you so much for being with us today.
Thank you.
Thanks for having us.
That's all the time we have for Wisconsin Doctors. From all of us here at Channel 57, we're inviting you to live longer, live better. We'll see you next time.